I have two guests today with the Kenora Community Palliative Care Committee. Theresa Bowen is on my far left. She has been running the Grief and Bereavement Program for 22 years, and Alexis Peplinskie is a nurse practitioner also on the committee. Can you just tell me a little bit about what the committee is about?
Well, I've been involved in the Kenora Community Palliative Care Committee for many years. Started actually when I was Director of Community Support. And that committee is an umbrella committee to oversee a number of programs that are involved in palliative care. And so it includes the palliative manager from the hospital, it includes social workers, it includes chaplain from the hospital, as well as people from the ministerial group in the community. It will include nurse practitioners.
I presume people from Pinecrest and Birchwood as well?
Exactly.
So everyone involved in palliative care is going to sit on the committee?
Hopefully.
Hopefully. They're invited.
Yes.
And palliative care is a bit of a scary word.
It is. A lot of people associate palliative care immediately with end-of-life care, and that's not actually the case. Palliative care is still very active treatment with a real focus on quality of life for people. But a lot of people, because of that association with end-of-life, it's, you've begun palliative care, you must be nearing the end of your journey, the end of life. So it can be an uncomfortable topic for some people to talk about. And I think as a community, we're working really hard at separating the two and educating people on the fact that palliative care, there's still a lot of quality of life that can be had when you're actively participating in palliative care.
And do you think that because people think it means end of care, it delays people getting involved in palliative care sooner?
I would have to agree with that. I've seen that in my own practice as a nurse practitioner, where people are, well, why are you here? I'm not dying yet. Where it's still active treatment, and we know the research actually shows that people's life is actually prolonged when they're receiving palliative care than it would be had they not received palliative care. So I think that's really important for people to know and to not be afraid of it. And it's very collaborative still with active treatments and with your primary care physicians and your healthcare team.
So when someone says, I think it's time for palliative care, what's the difference? What's the extra step that palliative care involves?
Palliative care tends to help facilitate a lot of conversations that are somewhat difficult and challenging to have. So talking about advanced care directives, talking about goals of care, what they would like, their final journey to actually look like, whether that's community-based or hospital-based. It's weighing the options of, I want to pursue this treatment, and knowing that it's okay to say I don't want to pursue a certain treatment. So that's sort of how it looks a little bit different than our traditional model, and really working on facilitating those more difficult conversations and making it okay to talk about.
And are you having those conversations just with the patient, or does a loved one or family get involved?
I find palliative care tends to be more of a family-centered approach to health care. It's similar to pediatrics, where it's family-centered care, where it's your patient and the families, and palliative care for most and many families is exactly that. It's their loved ones, it's their extended family, it's their friends, it's their neighbors, everyone that cares about them and wants to see them live a good life.
And Theresa, I imagine sometimes, and I don't know if it would be the patient or the loved ones, that someone is a bit further ahead on the idea of palliative care and someone may be still in denial. How do you work with that?
Well, I really think that's Alexis' job, as well as social workers who work with people in this situation. And oftentimes in families, there are, one member is definitely further ahead than the other. And it takes time for people to catch up. And it's a learning process for them as well. But it's the information that's provided, and I think by people like Alexis.
And having those discussions, I guess.
Yeah, and a lot of these discussions families aren't having. I think about my own family, and it wasn't until I started working more in palliative care that you start thinking about those conversations, or you have a loved one who passes, and you really start thinking about, how do I want things to be, or what would I be willing to go through in terms of treatment, and if I was to become unwell. And like Theresa, alludes to, in terms of everyone's at a different space or at a different place in terms of their journey of acceptance. And, we grieve after the death of a loved one, but there's also a grieving process that goes along with, a poor or terminal diagnosis for families. And people are at different places on that grieving process with that diagnosis. And you'll see those challenges, and you'll see people struggle through that grief before there's even a passing of a loved one.
So if someone has a diagnosis of a terminal illness, how do you even open that conversation, recognizing that basically that's the start of the grieving process?
I think our healthcare providers in the community are doing a really good job at opening that door. We have a lot of support, palliative care support through Thunder Bay and through the regional palliative care program. So that's that first point of contact where those conversations are starting to happen for people. And in healthcare in general, I just was involved in a discussion not that long ago that just in general in our practice, that as practitioners, we should be facilitating those questions about power of attorney and, what are your advanced care plan, and, do you have specific wishes that you would like to, fulfill as you go along, regardless of whether or not you have a terminal illness. And so by having practitioners starting to incorporate that and normalize that and make that the standard on an annual physical or at a regular checkups with primary care providers.
Are you encouraging? Because I don't think I've ever had a doctor ask me any of those questions, and I'm often talking about the importance of power of attorneys.
Yeah, I feel like the conversation's starting to happen, and there's a push and an encouragement that will become part of standard practice in primary care. And the palliative care committee, across the country is really trying to encourage that be incorporated on at least an annual basis for practitioners to be asking about. Things can change on a dime, and that's one thing I've learned working in palliative care is, things can happen really quickly and things can change really quickly, and having those conversations in advance really help that transition through the diagnosis.
And if someone thinks, I'm not sure if palliative care is right at this time, but I want a bit more information, where do they find that information?
I think there's a lot of different points of contact in the community. Discussing with your healthcare provider is sort of a good start for that. We have a group of hospice palliative care volunteers in the community as well, which is based out of Pinecrest long-term care home. They work independently from Pinecrest, but they're located there. And Sharon McIsaac provides a lot of information to people in terms of what palliative care looks like. The Attorney General has accessible online documents that can be downloaded to allow people to complete power of attorney for their personal care as well as finances, which are free of charge, and they're legal documents that people can complete.
And you can also pick them up at Service Ontario.
Yes, as well. So those are some good places to start.
Yeah, there's also the virtual hospice.
Yes.
That is a website that has all kinds of information, and it's a really good place to look for resources.
Okay, we're going to take a short break. Please come back and join us in a few minutes. Welcome back to Sitting with Sally. I'm talking to two volunteers with the Palliative Care Committee. And during the break, we were talking about we're all going to die. And Alexis, you were talking about having those difficult conversations. We don't even talk about that when we're healthy.
It's true, and I find when you're healthy, it's one of those best times to have those conversations. You know, you don't have the added stress or the worry of a possibly terminal diagnosis. And it's also an opportunity to make early arrangements or early plans and really communicate with your family and your loved ones what you would like or how you would like things done. You know, so often I see families, questioning or struggling or, would mom want this or did she want things that way or this way? And when you're healthy and when you're well, it's a great opportunity to make those decisions. And I know
and to be able to think clearly about it.
Exactly. And I find we don't necessarily make it a priority. And we are all going to die, right? Like as we alluded to and as we commented on, and we all go through that journey at some point in our lives. And when that may be, often we have no segue or we have no warning as to when that might happen. So when you're healthy and when you're well is a great time to start having those conversations.
I would think too that if someone is looking to palliative care when a family's in crisis, it's much more difficult for the people involved in the care to become involved at that point.
I would agree with that as well, and it's nice to develop a relationship with families. It develops a level of trust. You can develop that therapeutic relationship not only with a patient or a client, but with family members as well. And a lot of times our palliative care services, they're not part of your regular healthcare team initially or even, early in your journey. And it's not standardized to be meeting palliative care people, healthcare providers when you're well, right? So it's really nice to become involved early. As I noted earlier, active palliative care treatment actually extends life, and there's well-documented research to support that. So it's a great approach.
And what's one of the number one questions you get asked?
I think the number one question I get asked as a practitioner is how much time do I have? People want to know how long they have to live. And as healthcare providers, even some of our most experienced, qualified healthcare providers are really quite poor at providing an accurate prognosis for people. And I'm seeing more and more and more, especially in our oncology field, where those oncology specialists are moving away from giving those prognoses because they're so inaccurate. And in my own personal experience with patients and clients, I've seen people, we're a year or 2 years down the road and, they say to me, I was told I had 2 months to live and we're 2 years out, right? And then we also have quite the opposite, which often stems a lot of anger for families is, they're gone, it's only been 2 weeks, we were told we had 6 months.
They wanted more time.
They wanted more time. Mm-hmm. So patients ask me this all the time. They want a number and unfortunately I can't give it to them.
And I presume what palliative care tries to do is say it doesn't matter how many weeks, try and make the best or the most of it.
Exactly. And one thing I've learned in a very short period of time is you don't know when that time is going to be. So make every day your best day, right? And if there's conversations you want to have them. If there's places you want to go. Make sure you're doing what you want to do because you don't know when that time may be up.
I just want to add something. When we were talking about dying or making preparations, that personally, from my experience, like I've been involved in this field for many years. I've experienced the death of a spouse, and yet it's hard for me to talk to my kids, who are adults now, about what all my wishes are sometimes. Sometimes I slip little comments in. I found it easy enough to make sure that I have a will prepared, make sure that I have my power of care for personal care and for finances done. It's easy enough to do that part, but the conversation isn't easy.
Oh, so you who've been doing this for decades,
Yes.
haven't sat down and said, okay, kids, we're having this conversation today. You're going to listen to me and ask questions?
Well, yeah, no, I haven't sat down specifically like that. I have, slipped in a few comments here and there, and but yeah, and I've been involved in it for a long time and know that that's what we need to do, but it's not easy to do.
No, and again, it goes back to our initial, people don't like to talk about dying at any time.
No. As a society, it's sort of that
Well, we're
taboo,
we're so
right?
youth-oriented, yes.
Yeah, we don't talk about it.
I'm thinking as you're talking, it's a very different journey for the primary caregiver and a person who is being diagnosed with a terminal illness. And can you comment on that, Theresa, at all?
Well, I certainly think it is. The primary caregiver often gets caught up in the caring, and sometimes it becomes emotionally difficult to be involved emotionally. So we tend to cut ourselves off and be the caregiver and not really look at what's happening. And sometimes we don't have the time to look at what's happening when we are a caregiver, that primary caregiver.
And I would think, too, as a patient with terminal illness, one of the things you're learning to do is to let go.
Yeah.
Yes.
Yeah, and when we mentioned earlier about how each person is sort of, you go through your own grieving stage even at that stage of the process, and it can be very difficult for loved ones. Loved ones carry a number of different roles, right? Whether not only are you're a spouse, or you're a daughter, or you're a son, or you have a profession, you're your own mother to your own children, or your own father.
Your life is going on at the same time.
Right.
Yes,
Exactly.
Yes. And I think, too, Theresa, what you're saying about emotionally, either you're distancing yourself, or you might decide to keep busy, but respite can also be very helpful for a caregiver.
That's right. And that's why we have the visiting hospice program, where we use volunteers who are able to come in and provide respite for a caregiver. And, they might come in for a couple of hours and spend some time while you get the opportunity to go out and do something. Sometimes they take people out and give them an outing so that it's not always on your shoulders. So the visiting hospice program is very important and a huge part of caregiving.
I would think one of the messages to caregivers is that if you can't take care of yourself, or if you don't take care of yourself, it's going to be much more difficult to continue the long journey.
Exactly.
It's really difficult to care for others when you're not being able to care for yourself as well. And that's across the board, for any illness or any disease process, or you have to really look after yourself. And I find a lot of caregivers feel a little bit of guilt around that, that they have to be giving just so much.
I
to
shouldn't
their
be
loved
getting my
ones.
hair done. Well, yeah.
Exactly.
And what's the answer to that?
They need to care for themselves before they can care for others. Yeah.
And you had mentioned earlier the bereavement process. Can you talk about maybe some of the steps as the journey goes along?
Well, I've been involved in the bereavement process for 22 years, and basically where I became involved is because I had a spouse who died 23 years ago, and I looked around and thought, okay, how do I do this now? I see other people who've experienced the same thing, had a spouse that died, and okay, they're doing all right, but then I realized that this was darn hard work, and how was I going to do that? And so I had to look for places to get help, and that's how I became involved in that process. And so part of my role is to provide people with the tools to be able to grieve and to mourn. and how do we do that? Because we don't know how to do it, you know, and each death that we experience, we'll mourn differently, and if we have the tools and the understanding of what we're going through, it definitely makes it, I don't know if it's easier, but it's helpful.
It helps people move
Yeah.
along.
That's right.
Well, we're going to take another short break, and please come back and join us for the last part of our talk about palliative care. Welcome back to Sitting with Sallie. I've been talking about palliative care, and we are talking about bereavement. And Theresa, you've been running a grief and bereavement program for 22 years now. Who should be attending your program?
Well, that program is open to anyone who wants to come who's lost a loved one through death. And so people come.
Not just a spouse, then?
No. So that could be, you could have lost a friend, it could be a child, it could be a parent, a sibling who has died. And so all of these people have attended the group over the years.
So
the
you've
group is
lost
mixed.
someone and you feel a little lost.
That's right.
Yes.
Yeah. And it's, you know, we try and include everyone, of course.
And what are some of the coping skills? What are some of the tools that you give people to help cope?
So some of the tools are, first off, to understand what grief and bereavement is all about, and mourning, and how to mourn, how to bring out what's inside, outside. And as we say, you know, grief gone public is what mourning is about, and how to be able to maybe cry. That's okay. It's okay to have tears and to feel the way you're feeling. And it's by the sharing of the people in the group that you understand that you're not alone in this. It's also, we learn how to take care of ourselves. We also learn that there are special moments that happen after someone dies. Sometimes we have, you know, where we just know that we're touched by someone else. And it's okay to understand that and see that that's real. And so there's many tools to learn.
It's a process.
It is a process, for sure. And it's really important to learn that these people that we loved, we can still love, even though they're not here, maybe present with us. It's like when our children go away to university and they go away somewhere else. We still love them, even though they aren't present in our homes or, you know. So this is the same as when someone dies. And I think that was sort of a light bulb moment for me to realize that I didn't have to do the letting go, that my husband could be a part of my life forever. I have 7 grandchildren now who never knew their grandfather. They never met him, but they know him, and they refer to him as their grandfather. And he's a part of their lives. So those are the things that we need to learn. We need to learn how to maybe what to do with the things that are left behind, the clothing, or how to keep some of these things. How do we keep them? Maybe we make memory boxes, and there's a number of things that we can learn.
That's interesting, because I've known people who have lost a child, which is very difficult, and then never talk about that child again.
Yeah.
So that's, yes.
And oftentimes you do see that. But I think society is changing, and that we are talking more. And I think that's the important thing, is to learn how to talk about these people and to keep their memories alive.
And in 2017, we had our first National Bereavement Day in November.
Yes. So that is continuing on. So this year will be the 2nd annual National Bereavement Day on November 20th. And as part of this committee, that's what we're trying to look ahead to and to bring attention to.
And what is the focus of National Bereavement Day?
I feel like it's just a recognition that it's okay to grieve. You know, it's important to recognize and acknowledge, and it's really, I feel like it's a really nice recognition that, you know, we're moving into the second year of it being actually recognized.
And take a moment to think about a loved one who may not be here.
Exactly. And when, you know, Theresa talks about, you know, society is changing and recognizing that this is important and this is a part of people and people's experiences and people's lives. It's an opportunity, you know, to reflect and celebrate.
And one of the things I think that is very lovely that Kenora does is the ice candles every December 24th.
Exactly. I am just a huge advocate of the ice candles, and I think that's one of the best things that Kenora has done, because it allows, Christmas time is a very difficult time for people who've had a loved one die, and this allows us to come together to talk about that person. I think there's nothing better than when I leave church on Christmas Eve and I hear people saying, I'm going to the cemetery, you know, we're going there, they're gathering there, they're celebrating that life, and they're able to talk about it. It allows us to talk about it.
And it's a very beautiful with the sun, you know, it's getting dark and all the lights of the candles come out from the snow. Yeah.
It is, it's huge.
Going back when we were talking about the palliative journey, earlier you had made a comment about being present in the moment. Can you just talk a bit about that?
Yeah, it's, you know, as people go through that grief process, it is really important to be present. You know, we can look back to, you know, what yesterday or last week was, or, you know, what about this or what about that, or how could things be different? And also looking ahead, you know, when we talk about that, wanting that prognosis, knowing how much time I have. You know, you really need to be present, and you really need to live each day as though it was your last. I think it's really important, not only for patients, but for family members. And I see family members particularly struggle with this. You know, what's next? What's the next treatment? What are we going to do next? And sort of that urgency with that. And it's just really important for patients, for their loved ones as well as themselves, to just be there in that moment and to really cherish it.
Enjoy being with that person.
Yep.
Yeah. Not always easy, I'm sure.
It's not, and you know, part of having those difficult conversations is being present there to allow those conversations to happen.
Thank you both for coming in, and palliative care is a difficult subject to talk about, but I think you're both right. The sooner we start talking about things like that are difficult, the better outcomes we'll have.
Thank you.
Thank you.
Please join us next time for Sitting with Sallie.